Welcome back. In tonight's Family First, May is National Stroke Awareness Month. And being aware of what strokes look like is critical, which is exactly why it should be a whole family concern. Here's Fox 61's Tim Lammers with more on why.
A stroke is kind of like a heart attack, but in the brain. And like a heart attack, the symptoms aren't always what they look like on TV or what you think they might look like. So all family members need to be able to recognize those symptoms, because when a stroke happens to you or a loved one, minutes matter.
About 2 million brain cells die every minute, and about 14 billion connections die every minute as well.
Dr. Dimitre Mirtchev is the stroke director at St. Francis Hospital in Hartford. He said the brain damage starts as soon as the symptoms do, and it happens quickly.
Timing is very important, and for stroke symptoms, one of the most important things is they are sudden. So 1 second you're fine, the next second you're not.
And there is a collection of symptoms to look for. To make it easy to remember, there's an acronym to help: Be Fast.
B is for balance or dizziness, vertigo. So if somebody's, and again, these are sudden symptoms, like you're walking down the road and all of a sudden you start veering to one side. The E, the next one in Be Fast, is for eye. So any sudden eye vision loss or double vision. The F is for face, so any facial droop. Again, 911. A is for arm and leg weakness. Sometimes it may not be weakness, it may be clumsiness. So anything off about your limbs on one side should prompt you to act right away. The next letter would be for speech problems. So any slurred speech or difficulty expressing yourself or word finding difficulty, or people might seem confused to you when you talk to them. And then of course T is for time. Act right away, call 911.
Now, if the stroke is being caused by a blood clot, you've got about 4.5 hours from symptom onset to get to a hospital for a powerful blood thinner treatment that can help. But a stroke could also be caused by a hemorrhage, a brain bleed. And that's why Dr. Mirtchev said you should not chew an aspirin if you get symptoms like you might with a heart attack, because that would make a brain bleed even worse. Instead, just call 911. I'm Tim Lammers, Fox 61, Connecticut's news station.